Today is World Cancer Day, a global initiative to raise awareness and educate people about life-saving treatments and ways to prevent death. Colon cancer impacting Black Americans at an alarming rate. The American Cancer Society says Black people are 20% more likely to develop the disease and 40% more likely to die from it. Our next guest lost his wife to colon cancer and has since become an advocate for raising awareness in Black and brown communities. Joining us now is Bechir Sylvain. He is the founder of Brown Sugar Rehab. First off, sir, I just want to give you my condolences.
Thank you very much.
Let's start with you telling us about your wife, Shannon, before the diagnosis.
Shannon was an incredible human being, a trailblazer, someone that worked in the industry. She started off in NBC and then started working at HBO. We met actually when she was working at NBC, and once we got married, everything was, of course, just like anything else, great. A year later, she was diagnosed for colon cancer.
How did they find that diagnosis? Was it something that prompted her to go to the hospital?
Well, the one thing that we know about this disease is that it's a silent disease, right? It's a silent killer. So she had no symptoms technically. She went to a doctor for just a checkup, and she told the doctor that, she was seeing blood in her stool. It was like very faint. And the doctor was like, okay, well, we could try to do some tests to make sure that it's fine. They did, and it still was there. And so they told her to pretty much do a colonoscopy. And at that time, and we all know that you have to be 50 to do a colonoscopy, but luckily enough, she has the insurance. So she decided to do the colonoscopy and find out that she was already on stage 4 of colon cancer. And it was literally by luck, by the fact that the doctor actually asked her if she wanted to do this test, that she found out the information.
I'm actually glad that you brought up that you have to be over 50 to have a colonoscopy, because it says 18,000 cases last year were diagnosed in people under 50. And most recently we heard about Chadwick Boseman, who died at the age of 43. Why do you think Black Americans are experiencing higher incident rates with this disease?
Well, a lot of it is the lack of awareness, right? And I think one of the major things, number one, Shannon was the one that is the founder and the creator of Brown Sugar Rehab, and her drive was all about making sure that we are aware. And that was one of the things that we're finding out, that people are waiting to 50 to do a procedure that can actually save your life. And I think they lowered it to 45, and still to this day, it's still not enough. I think if you have, especially in your history, that any family member that has that disease, it is required for you to at least get a check. So, she was diagnosed at 31. So we're still trying to figure out a best way to basically convince them to eliminate the age limit and to be able to be tested, because that is one of the major things. And also the lack of information for us. I mean, of course you could Google the disease, but they don't tell you all the things that we've learned through this process. And that's one of the most important things in this mission that she started, and one of the missions that I want to continue is to be able to bring awareness and give the correct information from a person that's not a doctor, from a regular human being that's just trying to live their life, to actually find the best way to be effective and actually stop a disease that is curable. So that is one of the major things I think that's stopping us, is the lack of information that's out there for us.
My goodness, 31 years old. How long did she live with the disease?
She was diagnosed stage 4. They gave her 6 months, and she survived 3 years. And a lot of it is because of the change of diet and all the things that we basically decided to do to fight this. I mean, we chose life no matter what. It was not an option. And those are a lot of the things that we really want to talk to our community there's so much that could be done to not only prevent, but also to extend the quality of life when you do have the disease. Because the doctors will tell you one thing, and it's easy to fall into it. I mean, it was shocking when we found out that she was already in stage 4. You know, a foot of her colon was taken away from her, and the amount of surgeries and all these things that she had to go through. But yet we took it upon ourselves to do everything that we could to basically beat this cancer, and we were successful to the point where she actually had remission after a year. So we were very hopeful for it, but unfortunately the disease attached itself to her liver, and once cancer pretty much goes into another area of your body, it's very hard to detect it. It really is more about the lymph nodes than anything. So I'm super eager and excited to tell people all the information that we've gone through. And I think it'll be very important, especially talking to someone that's, you know, we're not doctors, we're not experts, but we've gone through the experiences and we've seen what worked, and also the information that could have stopped this. And it's sad to see that there's nothing out there for our community, for us to go in and just look and say, okay, cool, these are the things that we could do.
Well, speaking of that, I can certainly feel that this is your life mission and your passion at this point. Can you tell me how the Alliance is raising awareness in the Black community?
Yes, the Alliance is actually in communication with us, and we are basically in the works to just rebrand the Brown Sugar Rehab to be exactly that. I mean, her goal was not only to give information, also is to create a platform where you could have the support, the financial support to have the colonoscopy, to have the correct testing kits to be able to detect this disease. And so we are determined. We have this fire under us that's literally just excited to really revamp and target our community as much as we can, especially now with the media. I mean, especially with, you know, all these new outlets that you do have, like from Instagram to TikTok, you name it, all these ways of people are getting so much information, but yet there's no information out there that actually is helping people's lives. So we really are excited to work with the Alliance and to make sure that we get the right information in the correct way, not to discourage anybody, but to actually inspire people. Because when giving people information, especially our community, you know, it's tough because we're giving so much false information sometimes. And also, you know, especially when it comes to our health in our community, we already know all the history behind that. So we're so excited to actually find a brand new approach, a personal approach, a human approach to this, to be able to really make a difference.
So my last question for you is, how can folks get information about the Alliance?
They definitely have their website right now. Brown Sugar Rehab will have their website up soon. And once it is up, please, it's just www.brownsugarrehab. And if you go into the Cancer Alliance website as well, they'll have all the information that you would need to learn about the disease and all the facilities that are out there that could help you. Those are the two places that we have thus far. And we are very excited to have more.
Well, Bechir, I just want to say I commend your strength and your perseverance, and I thank you so much for joining us on BNC News today. Best of luck, sir.
Oh, thank you. Thank you very much. I appreciate it.
And we'll be right back after this short break. Stick around with us. You're watching BNC News.